Hi, I'm Dr. Sherry, Chief Medical Officer of Women's Health at QuickMD. Today we're talking about something many women experience, but rarely talk about openly, and that's vaginal dryness, which also can bring on vaginal burning, irritation, pain with intercourse or sexual activity, urinary frequency, urgency, and urinary tract infections. These symptoms are incredibly common during perimenopause and especially during menopause, and they can affect everything from intimacy, exercise, to confidence, and just basic daily comfort. We'll walk through what causes these changes, what vaginal estrogen is, and how it can provide real, meaningful, and lifelong relief. During perimenopause and menopause, estrogen levels naturally decline. When this happens, the vaginal and vulvar tissue becomes thinner, drier, and much more sensitive. I often describe it like a plant that doesn't get enough water. The tissue loses moisture, elasticity, and protection, which is why burning, irritation, and pain can show up. This is where vaginal estrogen can definitely help. Vaginal estrogen restores moisture, elasticity, and thickness directly at the source with very little entering the rest of the body. So let's break down what vaginal estrogen actually is and how it works. Vaginal estrogen is a low-dose form of estrogen designed to treat symptoms directly inside the vagina and around the vaginal opening. It is not the same as hormone therapy taken by mouth or through the skin. This form of hormone treatment stays local. It stays inside the vagina, targeting right where the symptoms are. There are a few forms, but the two most commonly used vaginal estrogens are creams and pill inserts. Vaginal creams come in a small tube and can be applied with a vaginal applicator or your fingertip. The vaginal pill inserts are small, pre-measured tablets that you place inside the vagina with a one-time use applicator. There's also a vaginal ring that stays inside the vagina for 3 months and releases a steady, low dose of estrogen. For today's purpose, we're going to focus mainly on the vaginal pill inserts in creams. Vaginal estrogen works by helping restore moisture, thickening the tissue, and improving elasticity. It also helps rebuild the natural protective barrier inside the vagina. This means less dryness, less irritation, and less pain with sexual intercourse and sexual activity. It even helps support a healthier vaginal pH, which is why it can reduce the frequency of vaginal and urinary tract infections. A healthy vagina supports a healthier urinary tract system as well. Now, a question I hear all the time is whether vaginal estrogen affects the rest of the body. Now, for almost all women, the answer is no. Vaginal estrogen is a very low-dose form of estrogen designed to work locally inside the vagina. Only a tiny amount enters the bloodstream, if at all. This is very, very different from systemic hormone therapy. Another common question I hear is what to avoid when using vaginal estrogen. So try not to apply it right before intercourse. Give it a few hours to absorb and avoid using it at the exact same time as other vaginal products like sexual lubricants or vaginal moisturizers. Now let's clear up one of the biggest misconceptions about vaginal estrogen. Many women worry that it increases their breast cancer risk. Medical research does not support this at all. Now remember, vaginal estrogen stays locally. It does not increase your risk of breast cancer in postmenopausal women. If you have a personal history of breast cancer, treatment decisions should always be made together with your healthcare team. But for most women, vaginal estrogen is considered very safe for our breast cancer thrivers. Now that you know what vaginal estrogen is and how it works, let's talk about benefits to expect. Vaginal estrogen can make a meaningful difference in vaginal burning, dryness, irritation, and pain during sexual intercourse. It can also improve urinary symptoms like urgency, frequency, and recurrent urinary tract infections. Some women even notice better lubrication and comfort with intimacy, which can help support libido and sexual desire. So how long does it take to work? Many women feel improvement within a few weeks. Full benefits often develop over 2 to 3 months. Women who have moderate to severe dryness or urinary symptoms usually see the biggest changes, so be patient. A question I hear often is whether vaginal estrogen needs to be used forever. Well, not always, but symptoms often return when treatment stops because the underlying cause, which is low estrogen, hasn't changed. Many women choose to use it long-term at a maintenance dose, but the schedule can be adjusted based on your needs. Now let's talk about how to use estrogen safely and correctly. So let's start with the inserts. Inserts are small tablets that go inside the vagina with a slender, one-time use applicator. You gently place the one-time applicator with the pill at the tip of the applicator deep into the back of the vagina and release it. It's very simple to use. The tablet will dissolve on its own, usually within a few hours or overnight. Now with the estrogen creams, they can be applied with an applicator or with a clean fingertip. You apply a small amount inside the vagina. Now, if you have irritation at the vaginal opening, some women use a tiny amount estrogen cream externally as well. Many women wonder whether applying cream is messy. Well, the truth is, creams can be a slight bit more messy than the tablet, but using them at night is an easy way to avoid this problem. Many women adjust to this routine very quickly and are very happy with the results. Now let's talk about dosing. Most treatments start with daily use for 2 weeks, and after that, the dose usually shifts 2 or 3 times per week for maintenance. Your doctor will recommend the treatment plan that is just right for you. A question I hear all the time is whether progesterone is needed alongside using vaginal estrogen, and the answer is no. Since vaginal estrogen is low dose and stays locally, you do not need progesterone to protect the uterus as you would be doing systemic hormone treatment. Now let's talk about the risks. Vaginal estrogen is considered very safe for women. Side effects are rare and usually mild, such as temporary discharge or breast tenderness, and most women actually don't feel any side effects at all. Some women have asked whether vaginal estrogen is safe after you've had breast cancer. For many breast cancer thrivers, yes, you can definitely use vaginal estrogen, especially when symptoms significantly affect your quality of life. But this should always be discussed with your healthcare providing team just to ensure that it is right for you, because everyone has a different situation. Now, there are times when vaginal estrogen should be avoided. If you have unexplained vaginal bleeding, recently have been diagnosed with an estrogen-sensitive cancer without medical clearance, or if your doctor has told you it is not appropriate for you, these are situations when not to use vaginal estrogen. But be sure to seek care if symptoms of vaginal dryness does not improve, if you develop vaginal bleeding, or if you have new pelvic pain that doesn't feel normal for you. Vaginal estrogen is one of the most effective and reliable treatments for restoring vaginal and urinary discomfort during perimenopause and menopause. The vagina and bladder do not function well when they are not treated with vaginal estrogen. This is why I believe all perimenopause and menopause vaginas should be using vaginal estrogen. I always say, if it's predictable, it's preventable. And remember, vaginal estrogen is very low dose. It works locally, and most importantly, it can make a significant difference if you are struggling and suffering from vaginal discomfort, dryness, irritation, pain with intercourse, intimacy, urinary frequency or urgency, and urinary tract infections. I hope this helped you feel more informed, more confident, and more supported in understanding your treatment options. Thank you for spending time with me today.